You know, there's almost nothing more frightening than seeing a child you care about in distress, especially when it's something neurological. It can make you feel completely powerless. But here's the thing, knowledge is power. It really is. It can turn that fear into focused, confident action. Today, we're going to unpack some of these conditions to help you feel more prepared. So let's start with just how common one of these events actually is. 4%. What does that number mean? Well, that's the percentage of kids who are affected by something called febrile seizures. And while that might sound a little scary, it just goes to show you how common this is. So understanding this stuff isn't just for doctors and nurses. It's really important knowledge for any parent or caregiver out there.
All right, so here's our game plan. We're going to break down 3 key conditions: febrile seizures, hydrocephalus, and spina bifida. And you'll want to stick around because at the end, we're going to get into the really practical stuff, the concrete steps that you, as a caregiver, can take to provide the absolute best support.
Okay, first up, febrile seizures. This is one of the most common reasons a young child might end up in the emergency room. So let's get right into what they are, and maybe more importantly, what they're not.
So at its heart, the definition is pretty simple. A febrile seizure is a convulsion in a child, and it's brought on by a fever. And here's the key part, the part you really need to remember. It's not caused by an infection in the brain itself, like meningitis.
Okay, so for something to actually be a febrile seizure, it has to check a few specific boxes. First off, there's a specific age window. It almost always happens between 6 months and 5 years old. Second, it's got to be connected to a fever. And last, and this is a big one, the child doesn't have a history of seizures without a fever. That's a really key piece of information that helps doctors tell it apart from something like epilepsy.
I know seeing a seizure happen can make you feel totally helpless, but what you do in that moment is so important. Your main job is to keep that child safe and prevent any injuries while it's happening. So what can you do? Well, the most important things are actually pretty simple, but they make a huge difference. If they're in a bed, you want padded side rails up. Loosen any tight clothes, especially around the neck so they can breathe easily. This is huge. Stay with them. Your calm presence makes a world of difference. And here's the part that's honestly the hardest for most people. Don't try to hold them down. Don't put anything in their mouth. You just have to let the seizure run its course. Trying to interfere can actually cause more harm both to the child and to you.
All right, let's switch gears and talk about our next condition, hydrocephalus. And this one is all about pressure. See, it's what happens when there's a buildup of fluid inside the brain, and that creates this harmful pressure, what doctors call intracranial pressure, on all that delicate tissue. So, think about a baby's head. The bones in their skull aren't all fused together yet, right? They've got these little gaps, the sutures, and those soft spots we call fontanelles. Now, that flexibility is totally normal, but it's also why one of the very first signs of hydrocephalus can be the head growing way too fast. The skull is literally expanding to try and make room for that extra fluid.
And you, the caregivers, are on the front lines. You're often the very first people to spot these subtle but really critical signs. An unusually fast-growing head, for example. Or you might notice that soft spot feels kind of tense or bulging, not soft like it should be. The veins on the scalp might look bigger. Even things you might not think are related, like a really high-pitched cry or if they're having trouble feeding, those can all be signs of that pressure building up.
So what is actually happening inside the brain? This picture makes it super clear. Okay, look on the left, that's picture A. See those spaces? Those are the ventricles, the brain's natural fluid-filled areas. Totally normal. Now look at B on the right. Wow. See how much bigger those ventricles are? That's hydrocephalus. That's all that fluid buildup we've been talking about, and you can really see the pressure it must be causing.
So when it comes to managing hydrocephalus, the goals are really straightforward. Number 1, you got to relieve that pressure. That's the top priority. Number 2, you want to prevent and manage any complications that could pop up. And 3, you need to deal with whatever caused the whole thing in the first place.
And how do they do that? Well, the most common treatment is surgery to put in something called a shunt. If you look at this diagram, you can see what it is. It's basically a tiny, flexible tube that acts like a new drain pipe for the brain. It takes that extra cerebral spinal fluid from the brain and drains it down into the belly, where the body can just safely absorb it. Pretty amazing, right?
Okay, on to our third and final condition for today, spina bifida. This is something that happens really early in pregnancy, when the neural tube, that's the structure that's supposed to become the brain and spinal cord, doesn't fully close up the way it should. This picture does a great job of showing the 3 main types of spina bifida, and you can see they're pretty different in terms of severity. You've got occulta, which is the mildest, then meningeocele in the middle, and myelomeningocele, which is the most severe.
And what really separates them, as we're about to see, is what's actually inside that opening in the spine. So first we have spina bifida occulta. They call it the hidden form, and for good reason. There's no opening on the back. A lot of people have this and don't even know it. Sometimes the only sign might be a little dimple on the lower back, or a small patch of dark hair, or a soft, fatty lump. Most of the time it's mild, but it can sometimes cause some issues with bowel and bladder control.
Okay, so with the other two types, there is a sac that's visible on the outside, and the absolute key difference between them is what's inside that sac. With meningocele, the sac has the protective membranes and spinal fluid, but, and this is important, the spinal cord itself is safe inside. But with myelomeningocele, that sac contains everything, the fluid, the membranes, and the spinal nerves. And because those nerves are exposed, that's what leads to problems with movement and sensation. It's why that baby needs immediate, super specialized care right after being born.
Okay, so we've talked about what these conditions are. Now let's get to what is maybe the most important part of all of this. What can caregivers do? What are the practical, real-world steps you can take to help? We've already touched on seizure safety, so let's dig a little deeper now into the kind of hands-on care needed for a major procedure, like the shunt surgery for hydrocephalus we just talked about.
So, if a child with hydrocephalus is going in for that shunt surgery, the care that happens before the operation is absolutely critical. The goal here is to keep the child as stable and comfortable as possible, and just keep a close watch for any symptoms getting worse. This is all about gentle, proactive care. You're measuring their head every day to keep an eye on that pressure. You have to be so careful supporting their head when you hold them because their little neck muscles are under a lot of strain. Special bedding can prevent skin sores from developing on their head. And giving them small, frequent meals helps prevent vomiting because throwing up can actually make that pressure in their head spike, which is exactly what you want to avoid. All right, surgery's done, the shunt is in. Now the focus totally shifts to recovery and being a super careful observer. You, as the caregiver, are the one who's going to spot the first signs if something's not right, like an infection or a problem with the shunt itself.
And the care after surgery is just as specific and just as important. Usually, you'll position the child on the side without the shunt to avoid putting any pressure on that delicate new valve. At first, they'll likely be kept flat, because you don't want that fluid draining too quickly and causing problems. And you're on the lookout for any of those signs of pressure returning, like being really fussy or vomiting. That could mean the shunt is blocked. Or if their belly looks swollen, that might signal a problem at the other end.
And this right here is probably the most important thing to take away from all of this. It's so important for caregivers to know the signs of shunt failure, and you have to trust your gut. If you suspect something is wrong, you need to get medical help right away. Never forget that you are the child's #1 advocate. You know them best. So, look, by breaking all of this down, my hope is that we've replaced some of that scary uncertainty with real understanding. The fear? It might not ever go away completely, and that's okay. But when you balance that fear with knowledge, you can act with more calm, more confidence. You can be a better, more compassionate caregiver. So the real question isn't if you can handle these challenges, it's how this information empowers you to handle them even better.